How do selective and non-selective beta blockers compare? Imagine your blood pressure is like a busy highway, and beta blockers are the traffic controllers helping to slow things down. Now, not all traffic controllers work the same way. Some focus only on certain lanes, while others manage multiple routes. That's what makes understanding the difference between selective and non-selective beta blockers so important when managing high blood pressure. Beta blockers are medications that lower blood pressure by blocking the effects of adrenaline, the hormone that speeds up your heart and tightens blood vessels. They do this by attaching to specific proteins called beta receptors on cells. The main types are beta-1 receptors, mostly in the heart, and beta-2 receptors, found in the lungs and blood vessels. Selective beta blockers, like metoprolol and bisoprolol, mainly target beta-1 receptors. This means they focus on slowing the heart rate and reducing the force of heart contractions. Because they mainly act on the heart, they tend to cause fewer side effects related to the lungs or blood vessels. That makes them a good choice for people with asthma or lung problems. Non-selective beta blockers, such as propranolol and carvedilol, block both beta-1 and beta-2 receptors. This broader action affects not just the heart but also the lungs and blood vessels. As a result, they can lower heart rate more than selective ones, especially at higher doses. But because they block beta-2 receptors in the lungs, they can cause breathing issues like shortness of breath or worsen asthma symptoms. Both types can lower blood pressure effectively. Non-selective beta blockers usually reduce systolic blood pressure by about 8 to 10 millimeters of mercury and diastolic blood pressure by 5 to 7 millimeters of mercury. Selective beta blockers have a similar effect but mainly target the heart, so their impact might be more focused there. When it comes to side effects, non-selective beta blockers tend to lower heart rate more and can cause side effects like dizziness or fatigue. They also have a higher chance of causing breathing problems because of their action on beta-2 receptors. Selective beta blockers are less likely to cause these respiratory issues, making them safer for people with lung conditions. Studies show that non-selective beta blockers may cause more fluctuations in blood pressure readings over time. These fluctuations are linked to a higher risk of stroke. Because of this, doctors often prefer selective beta blockers for managing hypertension, especially in patients with other health issues. In practical terms, most people with high blood pressure are better off using selective beta blockers. They effectively lower blood pressure while causing fewer side effects. Non-selective beta blockers are usually reserved for specific cases, like when other medications don't work or in patients without lung problems. Doctors often combine beta blockers with other blood pressure medicines, like calcium channel blockers, to get better control. The choice between selective and non-selective depends on the patient's overall health, other conditions, and potential side effects. So, understanding these differences helps ensure the right medication is chosen for each person's unique needs.